Hello friends, I am Dr. Kiran Chouka, Senior Orthopedic Surgeon, Joint Replacement Surgeon at Manipal Hospital Bengaluru. Today I am here to talk to you about what are the criteria which I choose or who are the people who have to undergo knee replacement surgery, which is like a hot topic nowadays, or not many people are in need of this thing, and basically they're scared and they don't know who has to go or whether they can postpone or not. So my criteria, or I select the patients who are suffering with knee pain more than 6 months and their x-rays show that there is a joint reduction, space between the joint, the bones are reduced, and there is a severe pain more than beyond 6 months. They are dependent on medicines. They have to take at least medicine to get relief from the pain at least once, or one tablet a day or once in 2 days. Beyond like 3 months, if they are taking these medicines to get themselves relief from the pain, they are one set of people who have to undergo knee replacement surgery. Age is a very big criteria. Anyone who has severe pain with other criteria like x-rays and the age, anyone. I have operated a lady who was like 26-year-old and I operated a person who was 96 as well. So there is a wide spectrum of age where they need knee replacement surgery. And x-rays prompt me that they have severe osteoarthritis and the patient is almost like bedridden and they are not able to walk, they are able to barely walk few steps. I select those kind of patients who will definitely need knee replacement surgery. A person suffering with knee pain beyond whatever months, it might be 3 weeks or 6 weeks or 3 months, they let them go to a nearby orthopedic surgeon, get them evaluated, let them get x-rays done. So based on that thing, we can just decide the treatment.